ಬರೋಂತೆ ಅವು ಅಡ್ಡ ಹಾಕೊಂಡು
ಅಡ್ಡ ಹಾಕೊಂಡ ನಾನು ಮೂರು ಅಂತೇಳಿ
ಹಾಂ ಮಲ್ಲ ಅಂತ ಆಲ್ಪನಂತ
ಸರಿ ಅಣ್ಣ ಐತೆ
ಹಾಂ ಸರಿ
ಅಡ್ಡ ಸರ್ ಎಷ್ಟು
Kindly rise. Please be seated. To improve the golden moment of opportunity and catch the foot that is in a reach is a great art of life. A very warm morning to all the delegates, invited guests, professor and my dear friends. I, Rini D'Souza and Anika of 6th Family, on behalf of Srinivas College of Pharmacy, Vaikunta, Valachil, Mangaluru, and Indian Pharmaceutical Association Local Branch Mangaluru, we delighted to offer a gracious welcome to all of you to the pre-conference session of 6th National Conference on Innovative Practices in Clinical Training and Patient Safety. I request Dr. Krishnananda Kamath, Professor, Department of Pharmaceutics, Srinivas College of Pharmacy, and coordinator of today's function to escort the dignitaries on the dais and join them.
Prayers open our heart to divine inspiration, fueling the flame of innovation with us. I request Adra of First Family to kindly lead us in prayer. Kindly rise. ಏಕದಂತ ಕರುಣಾಭರಣ ಪಾಲಿಸೋ ಗಣನಾಯಕ ಏಕದಂತ ಕರುಣಾಭರಣ ಪಾಲಿಸೋ ಗಣನಾಯಕ ಓ ಮಹಂತ ಶೋಕಹಂತ ಪಾಲಿಸೋ ಶುಭದ I request Dr. E.V. Subramaniam, Professor, Head of Department, Pharmachemistry, Vice President, Indian Pharmaceutical Association, Local Branch, Mangaluru, to introduce and welcome our dignitaries to the gathering.
Good morning to you all. Today I am very happy to invite you all to the 6th National Conference on Innovative Practices and Clinical Training and Patient Safety. I am extremely happy to record that this college, Srinivas College of Pharmacy, has been striving hard and continuously to organize these events, especially national conference like this, as a professional ritual to gain updated information and knowledge and innovative research skills that are going on around in our country and also at international forum. This I wish to take you back, or I wish to wind the time clock 50 years back, wherein pharmacy profession was not known at all, not even 0.1% of the educated people were not heard what is pharmacy. They used to think B Pharma means B.Com. Even the physicians, doctors used to ask what is B Pharma. So that was the dormant stage of unevolved stage of pharmacy education. Today, after nearly 5 to 5.5 decades of advancement in the health sciences, software technology, information technology, and other fields, we are able to achieve to this stage. Pharmacies are continuously being forayed into different sectors of the profession. We are in the clinical pharmacy, we are in the pharmacovigilance, we are in the medical transcript writing, we are in the software development, we are in the research and formulation development, so on and so on. This is all possible because of the fruitful organization of the national conferences like this. So, for the beginners of the profession, this is a unique opportunity. This platform is giving you to shape your career by listening to the experienced professionals and also to see for yourself the investigative research articles that are going to be displayed from today onwards for 3 days, so that you will come to know what is going on in the pharmacy field. And especially, lot of things are going on in the clinical side, and today we are fortunate enough to have 2 experienced clinical pharmacists with us. I take this opportunity, let me introduce the chief guest of today's function, that is Sri Uday Kishore P. Uday Kishore P is a Assistant Drugs Controller, Mangalore, presently working here. He completed his B.Pharm from Government College of Pharmacy, Bangalore, followed by his post-graduation MS Pharmacy from National Institute of Pharmaceutical Research, Naipur, Hyderabad. After completing his post-graduation, he joined as Junior Research Scientist at Daiichi Sankyo Research Center, Gurgaon. Previously it was known as Ranbaxy Laboratories. Later on, he joined Indian Council of Medical Research, New Delhi, as a Senior Research Fellow and carried out his research in molecular pharmacology. Further, in 2013, he has delivered a presentation on airway diseases as a guest speaker at University of Bonn, Germany. In 2014, he joined the government service as Drugs Inspector and joined Drugs Control Department. Since then, he has been continuing his services in the Government of Karnataka Drugs Control Department. So, he is an experienced person. He knows about the Drugs and Cosmetics Act and all, because day to day he will be dealing with it. Sir, I welcome you to this function as a chief guest. Today, we are going to listen to 2 of our friends of our institution, also the alumni of our institution, that is Dr. Aldo Benny, and also Salman Paris, who have come taking their time off to speak to us, to share their experiences. I hope all the delegates will be immensely benefited by their lectures. I welcome both of you to this. Today's function, the president of the function, Dr. A.R. Shabaraya. In fact, Dr. Shabaraya does not require any introduction to this audience, but some of you newcomer, I find some new persons who have come, some people have come from faraway places. I take a little time to introduce this young intellectual, the architect and educationist, our principal and director, Dr. A.R. Shabaraya. He is man from this place only, South Kerala district, and he has studied in all phases of the pharmacy course. That is, he completed his diploma, he completed his B.Pharm, he completed his M.Pharm, all three as a meritorious candidate. Because I have a long association of more than 3.5 decades, almost 35 years with him. Because I know the ins and outs of this gentleman. He has been a working, hard-working, natured. He was student, he was my colleague. Now today is my principal. So I am enjoying his association at all three stages. So I have the liberty to speak to you about his nature and also his achievements. He is the member of, life member of almost all the professional bodies such as Indian Pharmaceutical Association National Body and also APTA, Association of Pharmaceutical Teachers of India, and International Pharmaceutical Federation, and also he enjoyed as a member of the officiating member of different academic bodies of the Rajiv Gandhi University and also the Board of Examining Authority, that is Drugs Control Department, which conducts the examinations of diploma. So he has been very active. He takes a lot of interest, keen interest in organizing the professional functions. And also he used to organize many competitive programs to the students, to the pharmacy students at various levels, wherever he was working, and also whenever he was a student of previous institutions. And at a very young age, during his first stint only, he was the recipient of Best Paper Award, sponsored by the Indian Drugs in 2007 and 8, as early as 2007 and 8. In this one, later on, he was fortunate enough to receive many international travel allowances. Because of that, he could almost visit all the continents except one or two, some Africa and South American continent. All he has covered. He visited France, he visited America, he visited Australia, he visited Sri Lanka, he visited Dubai, he visited Thailand. So on and so on. So he has guided almost 6 to 7 completed guidance, 6 to 7 candidates completed their PhD under guidance. More than 70 to 80 F.Pharm students have completed this one. He has the also distinction of having chaired a scientific session at the international conference at Bangkok. And at that conference, that time he is a student, even now our senior colleague, Dr. Professor Sripati he was awarded the best paper presentation in that conference. And you know that he has taken a very active role in the recent construction and consecration of the Lord Balaji statue in the temple. So all these are all achievements. I welcome with the simple introduction. I welcome him to this function. Thank you very much. I also welcome my colleague, Dr. Prashant Kamar and Dr. Satish, Dr. Viresh, and all other senior colleagues, Professor Sripati, Dr. Karnakar Hegde, Kumar Prasad, our Padmavati Prabhu, and all the conveners of different committees, all the students. I think one or two guests who have come from even from Gujarat also, our students, alumni. Everybody who has come tomorrow and day after tomorrow, I assure you, you will spend quality time and by acquiring the latest information on professional events. I welcome and wish you a very, very happy time. Thank you.
Thank you, sir, for your brief introduction and warm welcome. I extend a warm welcome to you, sir.
Happiness radiates like a fragrance from a flower and draws all good towards you. Now it's time to gloriously welcome the dignitaries on the race. I request Dr. Viresh K. Chandu, Professor, Department of Pharmaceutics, to welcome Shri Uday Kishore P., Assistant Drug Controller, Mangaluru, with a bouquet of flowers.
I request webinar of 6th Family to welcome Dr. Salman Faris A., Senior Clinical Pharmacist and Assistant Professor, Department of Pharmacology, ICRA International Hospital and Research Center, Calicut, with a bouquet of flowers.
I request Movie of 6th Family to welcome Dr. Endos Ben, Clinical Pharmacologist, KMC Hospital, Mangaluru, with a bouquet of flowers.
I request Yashaswini of 6th Family to welcome Dr. A.R. Shabraya, Principal and Director, Srinivas College of Pharmacy and President, Indian Pharmaceutical Association, Local Branch, Mangaluru, convener of today's function with a bouquet of flowers.
I request Afia of 6th Family to welcome Dr. E.V.S. Subramaniam, Professor, Head Department of Pharmacochemistry, Vice President, Indian Pharmaceutical Association, Local Branch, Mangaluru, with a bouquet of flowers.
I request Sandra T. of 6th Family to welcome Dr. Krishnanand Kamath, Professor, Srinivas College of Pharmacy and Coordinator of today's function with bouquet of flowers. When darkness spreads, let the condemn the light dark but light a lamp to illuminate it. I request Sri Uday Kishore to inaugurate today's function by lighting the lamp. I request all the dignitaries on the dais to join. Kindly rise. Thank you, sir.
We are delighted to have with us Shri Uday Kishore P., Assistant Drug Controller, Mangaluru, as the Honorable Chief Guest of today's function. I invite Sir to speak few words.
Respected dignitaries on the dais, teaching and non-teaching faculty of Srinivas College of Pharmacy, and dear students. First of all, let me extend my warm wishes for the inauguration of innovative practices in clinical training and for patient safety 6th National Conference. So I am very delighted and happy to be in this event. So this is the second consecutive time where I am witnessing this event. So on this occasion, I would like to thank our principal, Dr. Shabraya sir, and management, and I am told that this entire conference is being being conducted and organized by students of Pharmacy College. So I would like to congratulate all the students and LOC, teaching and non-teaching faculty members for arranging such a national conference and get to in Mangalore. So today I am told that here PharmD and M.Pharma students are there, and on this occasion I will also congratulate our guests of honor, Dr. Salamal Faris A and Dr. Aldos Benny, so who are alumni of this college. See, I had a conversation with our principal sir. See, calling an alumni of a college as a guest of honor, it really means a lot. See, it gives you a motivation for you and even for the guests, so they also feel motivated. See, we are into a profession, pharmacy profession, so as our vice principal. See, earlier, like 50 years back, the pharmacy profession was just a pleasure and motor concept. But now, this pharmacy profession has evolved a lot. So, yesterday evolved, see, if you see internationally or globally, so pharmacy profession, so it is not on par with any other professions in through. It is much more than the other professions. If you see any share markets and all, you will be knowing. So if you see the regular industries and all, see pharma industries are at the peaks. And last decade, if you see, last 5-6 years only, so all entrepreneurs, they are willing to invest more in pharma, because pharmacy, Indian pharmacy, because Indian pharmacy, as you all know, it's considered as the world's pharmacy. So if you see the drugs manufactured or used in the entire world, so 1/3 or nearly 2/3 of the medicines are manufactured in India, and it is distributed to and supplied to the entire world. So we are into such a noble profession, so and we should all feel proud of it. As a pharmacist, we should feel proud of it. When we joined as a pharmacist, when we joined as a pharma student, so there was no such exposure in pharma. So there were conferences and all, but reachability was very less. But now the scenario is different. We have a very good administrator like Dr. Shabraya sir, and all your management who have organized this conference. So we should always proud of it. And coming to as a drug regulator, so let me speak on pharmacovigilance. So here many of the PharmD students are there. So for them I think it will be useful. If you see the pharmacovigilance, if you compare the pharmacovigilance, India's pharmacovigilance with the global thing, so we have a good setup here, and ADR reporting is also there. But the only difference between the global, if you speak about Western countries and an Indian scenario, ADR reporting. So ADR reporting in global, in Western countries and all, it's a mandatory one. But here, if you see ADR reporting, it's a voluntary. How many of you really know, PharmD students, ADR reporting is done through which portal? Any of the PharmD students here? Just I wanted to interact with you guys, because the concept here, today's session is clinical training and patient safety, where ADR is one of the major tool here. Any of the PharmD students? PharmD. ADR reporting India is out. Sorry? Which flow is? Okay. So which agency regulated? have you heard about Indian Pharmacopoeia Commission? Indian Pharmacopoeia Commission. So, Indian Pharmacopoeia Commission is the regulatory body. Along with CDSCO, CDSCO is Central Drug Control Department. So, where we are in the state, and the CDSCO is Central Drug Control Department. Along with these collaboration, so all area has to be monitored. So, if you see any of the hospital, for example, like KMC, Venlock, whatever, all the hospitals, they have a system called pharmacovigilance report form or ADR report form. So, if any ADR then this ADR has to be reported to Indian Pharmacopoeia Commission. This is how the Indian scenario is. In India, as of now, we don't have a limit, time limit. Critical, major, minor the classification we don't have a specific time limits. This is how we are different from the other Western countries. It doesn't mean that we don't have a strict patient safety system. See, we have a patient safety system. The only difference is in reporting. Because as I said to you, like Indian pharmacy is the world pharmacy in the country. Many of all the drugs has to be evaluated for clinical trials and patient safety and all. But the only difference is ADR reporting. But now, why ADR reporting is less than you may ask us. See, India being a very big country and with a high population, we have many institutions here. The only reason is the collaboration between pharma industries, your healthcare professionals and regulators. This is what lacking in India. I don't say that we are completely lacking in Kerala, but we need a better platform where all these three sectors has to be one day we have to take a uniform platform so that we can achieve these things. So Indian government of India is having they are having many plans and many policies are enforced. So where pharmacovigilance in India will be improved. So why I am hate in the sense PharmD students. So our career aspect is what I feel is they think of abroad countries so they do some other courses and all. But if you come to pharmacovigilance here, so there is much more scope. The only thing is that we need to give better awareness. See, almost all MNC companies, so they are having a pharmacovigilance setup. But as of now, globally they are doing. For them the clients are Canada, US and all. So Indian segment if it becomes a mandatory, then the scope of pharmacovigilance will be really broader sense of that. And all PharmD students, they will have a better opportunities. So as of now, all pharmacies, all hospitals and all, they have a course called as clinical pharmacist course. Here we have a guest of honor from KMC. So when I had interacted with him at KMC, I was told that so almost all corporate hospitals, they have these job opportunities. So you can avail that and you can really have a prosperous future in this. So before concluding my formal words, I am very delighted to be here. And as told, like tomorrow and day after tomorrow will be brainstorming sessions you have. So try to understand the regulatory aspects and pharmacovigilance aspects and patient safety aspects. So like globally and internationally, so that you will have a complete idea and you can take a wise decision and you can really have a good future in this pharma. With this, I thank Dr. Shabraya sir and management of Srinivas College of Pharmacy and all students for giving me the opportunity for being a chief guest and inaugurating this session. Thank you. Thank you.
Thank you, sir, for your influential message.
I request our respected principal, Dr. A.R. Shabraya, to deliver the presidential address.
Chief guest of today's function, Sri Kishore P, Assistant Drugs Controller, Mangalore. My friends, Dr. Salman Faris and Dr. Eldos Benny. My colleagues, members of Indian Pharmaceutical Associations and all delegates. At the outset, I would like to congratulate the Drug Control Department, all the members, for joining their hands for conducting various professional activities in our campus. Starting from the Deputy Drug Controller, Assistant Drug Controllers, always they will join with us and with all kind of support. What is their intention here? Yes, we have to give provide the safety aspects, bring good patient outcome. Health outcome has to be improved. That is in the hands of the pharmacist. You can have a very good scientist, you can have a very good molecule for treating any kind of disease, and you have a very good doctor for the diagnosis, but proper interpretation of the prescription or proper analysis of the prescription or proper training for the patient, if it is not done, the entire product will waste. The entire procedure will go waste. So, the safety, it is in the hands of the pharmacist or especially in the clinical pharmacist where he can monitor the patient's behavior or the drug actions. With that intention, we have taken this concept every year from our students, the budding pharmacists. Yes, they have to get exposure for the innovative clinical practices. If I find a super senior speakers, sometimes it will go high level. But our students, always they feel interest to listen, yes, what our senior says. This time when I discussed with the students and the organizing committee members, they said, yes sir, we have our seniors in national, international levels. We can have interaction with them, that is our intention. Because when your friend says something, yes, you have interest to listen more. If unknown person says the fact, yes, we will listen for 10 minutes and we may lose interest. So we identified our alumni. There are 3 people today going to interact with you. All 3, Dr. Eldos, the first batch of our FARMACY, and followed by Paris and Babaraj. Maybe the Babaraj, yes, he is going to interact with you. These 3 stars of our SCP today, one is serving in the local regional, one is in the interstate, one is in the international. You have an opportunity to interact with the 3 stars today. But just listen and interact, clarify your doubts because they are practicing pharmacists today. I am not telling that they are having high experience, rich experience in that, but whatever the practical problems what they are facing and how they are analyzing, that you have, he will share it and you can think it is a challenge or it is a opportunity for you to think about how to overcome it. Because any problems or any challenge, we will convert it as opportunity for our safety aspects to improve the development of the profession. With that intention, we have started this program and this is the 6th year. Every year, people are joining with us from all over India, and even I am very happy to say that note that more than 12 universities are participating in the program and going to present various papers. More than 20 colleges are participating. Then it shows that how the healthcare professionals are showing towards the conference or this concept, and they are participating and sharing their knowledge. This conference, pre-conference what we did today, yes, tomorrow and after tomorrow there is the presentations, you may not have much time to interact. But today, the practical aspects you can interact with the speakers. With that intention, we are conducting this pre-conference fully. You can have a free time to discuss no other presentations today, oral or poster presentations. And at this moment, I wish once again all the best. You have to utilize the opportunity or utilize this platform to share your knowledge. Wish you all the best. Thank you.
Thank you, sir.
As a token of gratitude and honor, I now request our principal, Dr. A.R. Shabaraya, to present a memento to Shri Uday Kishore P. Thank you, sir.
Gratitude is the fairest blossom which springs from the soul. As we here come to the end of inaugural ceremony, I invite Dr. Krishnanand Kaman to purpose a vote of thanks.
Dignitaries on the dais, my dear colleagues, delegates from various colleges, my dear students, good morning to all. It's my privilege to deliver vote of thanks on behalf of 6th IPC-TPS Organizing Committee, IPA Local Branch Mangalore and Srinivas College of Pharmacy, Mangalore. First, I would like to thank Chief Guest of today's inaugural function of pre-conference workshop, Sri Uday Kishore, Assistant Drug Controller Department, Mangalore, who spared his valuable time with us to grace this function, inaugurating and addressing our delegates. And also he has explained what is the status of Indian pharmaceutical industry, what is the importance of adverse drug reporting and importance of pharmacovigilance. Thank you, sir. Our sincere thanks to guests of honors of today's function, who are speakers of today's pre-conference workshop, Dr. Eldos Benny, Clinical Pharmacist, KMC Mangalore, and Dr. Salman Al-Faris A, Senior Clinical Pharmacist, Assistant Professor, Department of Pharmacology, IQRRAA, International Hospital and Research Center, Calicut, for their support. Thank you. Let me express our gratitude to our beloved Principal and Director, Dr. A.R. Shabaraya, President, IPA Local Branch, Mangalore, for his constant encouragement conducting such programs. Thank you, sir. We express our gratefulness to Dr. E.V.S. Subramanian, HOD, Pharmacochemistry Department and Vice President, IPA Local Branch, Mangalore, for his continuous support and guidance. I thank all the delegates from various colleges who are attending this pre-conference workshop. We thank all staff from other colleges and organizing committee members for their kind support and smooth conducting of this program. We thank Master of Ceremony for their support, efforts towards anchoring with their own ideas and styles of explanation. Finally, we thank one and all who directly and indirectly involved in this program. Thank you.
Thank you, sir. Now, I request Dr. Krishnanand Kaman, sir, to escort the dignitaries off the dais. We are going to start the scientific session shortly.
A very pleasant morning to one and all gathered here. I am Varshi
And we
welcome you to the plenary session of the 6th National Conference on Innovative Practice in Clinical Training and Patient Safety, organized by Indian Pharmaceutical Association, Dakshina Kannada District, Local Branch, Mangaluru, in association with Srinivas College of Pharmacy, Vaikunta, VALACHIL, Mangaluru.
Before we begin the scientific session, we ask you to please turn off your cell phones and electronic devices or put them on silent mode during the presentation to minimize distraction. We encourage the audience to actively engage after the presentation and maintain decorum.
Let us begin with the first session. I invite Dr. Andrew Spinney, clinical pharmacologist, KMC Hospital, Mangaluru, to take a seat on the stage.
Now, I request Ahmed Bilal of 6th Farm D to introduce our speaker, Dr. Eldos Benny.
Good morning all. I'm Ahmed Bilal of 6th Farm D. I'm honored to introduce today's speaker, Dr. Eldos Benny. He is a clinical pharmacologist, KMC Hospital, Mangalore. Sir is a clinical pharmacist with experience in providing evidence-based recommendation to the physician for the optimal patient care. He is an alumni of our college, currently serving as a clinical pharmacologist at Kasturba Medical College Hospital. As a researcher, he presented many posters and conducted training sessions on the antimicrobial stewardship. Sir is here to enlighten us on the topic empowering healthcare, the vital role of patient counseling and education. Sir, I request you to handle this.
Good morning, everyone. I would like to take this opportunity first to thank all our Srinivas College principal, HODs and other faculty members and student committees, as well as the Indian Pharmaceutical Association Bangalore branch for inviting me. As well as I feel very proud and privileged to be here as a guest, as a speaker in my alma mater. So this is where I studied my pharmacy, so I feel very proud to be here and speak to you at this occasion. So we will move on to the presentation. Everybody has a pen and paper? Everybody has. So I would like to request you to write down any one drug that you would like, your favorite drug, on a paper, piece of paper. Okay, faster the better. Any one drug, any simple drug. Everyone has written? Everybody has written? Yes. So imagine yourself as a patient. Okay. And you are going to take this drug. So write down your doubts. What do you want to ask your doctor, your pharmacist? Write down your doubts on this drug. If I am giving you this drug to take, what all doubts comes to your mind? Can you do that? At least 5 questions. At least 5 questions. Write down. So everyone has written? Done? Done? Yes or no? If everyone has written, we will move on, okay? So can anyone say what is patient counseling? So the topic is regarding patient counseling. So can anyone say what is patient counseling? Huh? Talking to a patient. Giving information to patient. Only giving information to patient is counseling. No, then? Huh? It is a two-way communication or one-way? Two-way communication. So, what do you expect in two-way communication? This everyone knows it's an important aspect of the pharmacy profession. Patient counseling gives, full therapeutic benefits from medications to the patient. So what all things you should keep in mind? What all things you should do while counseling a patient? What is patient counseling? What is the importance of patient counseling? What are the benefits? From the 3rd years, 4th years, we have a subject, no? Yeah. What are the benefits of patient counseling? Knowing about the medication. Okay. What do you know about the medication? What all things you learn about the medicine? Administration. Okay. So you are counseling the patient. So as a pharmacist or as any health professional who gives any drugs to the patient, first you should be aware what is the drug, what does the drug do to the body, why is the drug given, when the drug should be taken, when it should not be taken. What are the side effects? Any drug interactions, drug food interactions. Common ones, not rare ones, common ones you should be aware of. Then only you will be able to deliver it to the patients and the patients will get benefited. So importance of patient counseling. First thing is patient will recognize why medication is helpful for maintaining or promoting well-being. It's self-explanatory. Then patient will accept the support from healthcare professionals in establishing working relationship. So there will be a bond formed. Once you are counseling effectively, there will be a bond forming between patient and the healthcare professional. Then he will be free to ask you questions. He will be free to ask the questions he was reluctant to ask first. Whenever you go to a doctor, you will be first reluctant to ask some questions, right? Or else if you are in a classroom, when your teacher teaches you, you will be reluctant to ask doubts first. So once you know the person, once you are comfortable with them, you tend to ask more questions. Okay. Patient will develop ability to make more appropriate medication related decisions. So once I know paracetamol is for fever, paracetamol is for pain, and the doctor has written paracetamol when not needed, what will you do? If I educate the patient, I counsel the patient, this is for pain, this is for fever, and this you have to take whenever there is. In the future also you may utilize those informations. Then patient will improve coping strategies to deal with adverse effect and interactions. So, many of the medications have adverse effects. So, many times it comes to the patient, as a surprise. I was taking this medication, so suddenly I got this. I was taking this medication, I suddenly fell ill. These are the most common complaints. So these complaints can be alleviated by informing the patient at first. Okay, if you are taking this medicine, you will have these side effects. Okay. For example, today I was talking to the sir. He told he was taking steroids. So he got weight gain. He got. What is the side effect of steroids? Weight gain. Hyperglycemia, increased blood sugar levels. So, many of the patients, elderly patients or uneducated patients, when they get sugar, I was alright till last month I started taking this medicine. I have got sugar. So, it is a blame goes to the doctor and the medicine. Okay, in order to avoid this blame, you should be first primarily informing the patient. Okay. Hyperglycemia or increased blood sugar can happen. Not hyperglycemia, you should be informing into in common language, layman's language, increased blood sugar can happen. So you have to check your blood sugar regularly. Do not stop the medicine abruptly. All this information you have to pass to the patient. The next is patient will become more informed, efficient and active participant in disease treatment and self-care management. So once you inform, this medicine you have to regularly take. Or if you steroid, if you stop taking, there will be. What happens if you take steroids immediately? Abrupt discontinuation of steroids. Can we stop? How do you stop steroids? Taper the dose. So you have to teach the importance. So this will help patient adhering or patient compliance to the therapy. This will increase and patient benefits will be better. Then patient will show motivation towards taking medication to improve his or her health status. There are certain people fearing some side effects, fearing adverse reactions, fearing interactions. If you are taking coffee and some antibiotic, what happens? It will increase your acidity. So you have to advise the patient to refrain from drinking coffee. So if you are taking NSAIDs, you have to avoid coffee at least for 2 hours before and after taking the medicine. All this has to be informed to the patients. So he will feel more comfortable taking the medicine. So he will adhere to the therapy. Okay. The next we will go to medication medication counseling stages. First one is medication information. So, like I said, you are telling a patient, this is paracetamol, this you have to take for fever, this is given for fever, this is given for pain. So that is medication information. We are not looking into medication information. It's only a small component of patient counseling. Next thing is medication information transfer. So this transfer is to give essential information on taking the medication as directed. We are telling the patient, this is the medication doctor has prescribed, this is the dose, and you have to take it like this, once daily or twice daily, or whenever it is required, whenever there is pain, whenever there is fever. We are advising the patient so he can follow the directions and take the medications effectively. So this is patient medication information transfer. Next thing is medication information exchange. So this first was a monologue. Only one person was involved. I am telling the patient, or you are telling the patient. So what is to be done? Next thing, exchange. What do you mean by exchange? It's a monologue or a dialogue. Only one person is involved or two persons involved? Two persons. So here the objective of information exchange is to provide details related to medication and their use. The patient will also ask the questions. Understood? Any doubts so far? Okay. So it provides medical information and responding to questions of the individual. So this is medication information exchange. Next comes medication education. So we are educating the patient. Why it is given, how it has to be taken, all these things. A planned individual, group, interactive, collaborative learning experience. It can be anyone. Okay, you can teach a group of people, teach a group of similar patients or an individual. Okay, it is individualized. It is for each patient. One patient I am giving one recommendation. For example, paracetamol I am giving one dose to one patient. It may not be the dose for the next patient. So it will be individualized. So you have to identify groups, individualize dosing strategies, all those things you have to pass on to the patient on an individual basis. Like one patient will be taking one medicine for one thing. So for you, like for example, you might have seen metformin. It is used for hyperglycemia. Any other use of metformin? Off-label indications? PCOS. So if I give a metformin for PCOS and somebody comes and tells it's for sugar, what will be the effect on the patient? Will the patient continue taking that medicine? If I tell him it is for reducing blood sugar, will the patient continue to take? No. If it is vice versa, it is given for diabetes and somebody is coming and telling the patient it is given for PCOS, it will impact the patient adherence to the medicine. There will be a doubt in the patient's mind why it is given. So all those doubts should be alleviated during the process education. Then next one is medication counseling. So it's a healthcare professional's responsibility to support person's effort to develop medication management skills and to move in direction of self-responsibility, empathy, sincerity and patience. So this stage helps the patients to understand why it is given. There is a exchange of dialogues. I am asking the patient, like I have asked you to write down the questions, right? How many of you write down the questions? Yeah. These questions will be asked by the patients to the healthcare provider. Healthcare provider will give appropriate reply, individualized reply. For each patient, the reply will be different. According to the patient disease, there can be drug-drug interaction, there can be drug-food interaction, there can be drug-disease interaction. If the patient is having any other disease, that can impact. If the patient is not, some religious faith issues can happen. Some of the religions won't take vaccines. So all these things can be countered through medication counseling. It contains physical, psychological, socio-cultural, emotional, intellectual perspective as well as health beliefs and values of the individual must be respected. So I said, so all this aspect comes, it will be a very detailed session. So normally what we do, in the hospital, do we counsel the patients? Do we counsel the patients as per this definition? In the pharmacy, if you go in a pharmacy, what do you get? Medicines you will get, what instructions you will get? This is for fever, you have to take it morning after food, evening after food. So what is that? It is only exchange of medication transfer, medication information transfer. They know something, they are telling it to you. There is no opportunity for you to ask. There is no opportunity for a patient to ask the pharmacist or ask the doctor or healthcare provider why it is being given, how long should I take. All those questions in his mind remains as such. Unless he is counseled properly, we have to ask him why, what is his job, history, all those things have to be taken. I will come to that next time. So now it is basic components of medication counseling session. So we have, I think, who is then from third, fourth family? Third year, fourth year, fifth year, sixth year internship. How many are there? Okay, you have to ask, you have to answer these questions. Okay. So first thing is introduction of the session. What are the components of introductory section of patient counseling? Introductory section of patient counseling. No answers. Fourth year, third year. You should be fresh to the topic. So, we will go ahead. So, introductory section. First, conduct appropriate counseling introduction by identifying self and patient or patient's agent. Okay, first you have to identify yourself. I am your pharmacist, I am your doctor, I am your counselor. Whatever position you hold in counseling the patient, first you have to identify yourself. Next thing is you have to identify the patient. I have some information in my hand, you have to verify whether it is the same patient sitting in front of me. If you give wrong information, you will be giving some other patient's information to a second patient. Again it will lead to confusion and other medication error. So first, introduce yourself and verify the patient. Second one is explain the purpose of the counseling session. Okay, what happens in the hospital nowadays is patient comes to the hospital, they come to the pharmacy or they come to the counseling session at last, or if the patient is getting discharged, we provide counseling at the discharge medication. All those stages, what happens is patient will be in a hurry to leave. Okay, they will go to doctor, see the doctor, he will write blood test, do blood test, he will come to pharmacy at the end, go back to the doctor, doctor will write medicine, he will come to pharmacy at the end, he will be like, I am getting late, I have to go now, I have to go now. Or this is my train time, I have to go before this time. Or if you see discharge, I have already booked a taxi, so taxi is waiting for me, I have to go fast. These are the scenarios. So our intention is to explain the purpose of counseling session to the patient. So he will wait, he will listen to what we have to say. At least not in full. We will be able to educate the patients as much as we can. The next is review patient record prior to counseling. Before counseling, you should be able to know you should be knowing what the patient is having, what the patient is taking, what is the patient's condition, what is the patient's background. So for example, if I ask any of you, I am taking diclofenac, can you say why I am taking? Where is my pain? No, for that you have to collect background information. So you might have studied in different subjects about background information. Anything you need a background information to proceed further. So patient, anything given to the patient will have a background. Patient history will be there, social history will be there, alcoholic habits, smoking habits, all those things you have to know before counseling a patient. Next thing is obtain pertinent initial drug related information. So if the patient is having any allergies in the history, any patient medication history or medical history of the patient you have to take before counseling. Next thing is determines if the patient uses any other medication including OTCs, herbals, botanicals, alcohol which could inhibit or interact with prescribed medication. So these are patient's habits, or if the patient is, uneducated, he may not tell you, I am also taking Ayurvedic medicine, or I am also taking homeopathic medicine. What happened recently was, patient got admitted to the hospital. So patient's blood sugar, nobody is able to explain why it's getting low. Patient is not telling anything. So we asked the patient, what are things you take? So he is taking a kashaya or something else. And when given with other drugs, when given with one antibiotic, this kashaya is causing severe hypoglycemia. Blood sugar levels drop severely. Patient goes below 40 mg sugar levels when you are giving this both combined. So it is important to obtain this kind of background information and other medicines, drug interactions, to notice these drug interactions. Then determines if the patient has any other medical condition. So I told any comorbid conditions, because a drug can interact with, you might have learned, drug disease interaction. Any comorbidities can interact with the given drug, okay, prescribed drug. Next is assess the patient's understanding of reasons for therapy. You should ask the patient, do you know why this drug is given? It's an important question to ask to a patient. Most of the times, patients don't know why they are taking the medicine. So you might have experienced in your family, after joining family, people might have started asking you, what is this medicine for? Doctor has written this medicine, why did he write? How many of you have a diagnosis? Then only you will be able to explain it to the patient why this medicine is given to you. Next thing, assess any actual or potential concern problems of importance to the patients. So as I told earlier, some religious faith or some social norms, these things can influence the usage of drugs in patients. Many of the patients won't take syrups because many of the patients think syrup is highly sugar. That's misconception. Because somebody has told them syrup is sugar, so I am not taking it. So what is the remedy? What is the remedy we have? We have sugar-free syrups. Right? How many of you have taken Alex syrup? Nobody has taken for cough. So it comes to Alex SF and normal Alex also. So it is sugar-free. So there is sugar-free. Then there are religious norms. Certain part of the country, people don't take vaccines because there is a conspiracy theory. Vaccines are given for recently with the measles rubella vaccine. You might have got a message in WhatsApp. How many of you got the message in WhatsApp? So measles rubella vaccine is given by Melinda Gates Foundation. It is aimed to reduce the population, so it will make you infertile. This was the message. Okay. When it is communicated in a mass, you know what's the problem with WhatsApp communication? It is communicated in a mass. A lot of people get the information and it becomes a belief. It will be very difficult to break those beliefs. So once you get 100 messages saying this thing is for this, it will be very difficult to, for you to digest. It is not for that. Then discuss the name and indication of the medication. This is the last part. You have to just educate the patient. This is the medicine. Why is this given? Why is it given? Okay. This is introductory part to counseling. Next is content. So what is the next stage? What are the questions you have to ask to the patient? 2-3 questions from the audience. This is the content of the session. Okay. Healthcare provider explains dosage regimen. What is a dosage regimen? What is the difference between dosage and dosage regimen? So first year posology, pharmaceutics posology, you might have studied. What is dosage and dosage regimen? Raise your hand if you can say. list of all this information included is dosage judgment. All the information is given to the patient, including scheduling and duration of therapy when appropriate. So there are scheduled therapy. For example, chemotherapy. How is chemotherapy going on? Anyone have any idea, vague idea? How is chemotherapy done? For cancer patients, when you initiate chemotherapy, all the drugs are given continuously. Is all the drugs given continuously in chemotherapy? No, there are cycles of chemotherapy. So there is scheduling. Okay. So first cycle, these are the drugs, these are the dose, these are the days you have to take it. Second cycle, there is a schedule. These are the drug therapies, these are the drugs, these are the days you have to take it. So there is a scheduling. All this has to be explained to the patient. Next is assist the patient in developing a plan to incorporate a medication regimen to his or daily routine. So this is also one fine example that I have seen is my HOD, okay, previous HOD. He is a forgetful person. What he does is, what his doctor taught to him is the thing. See, he regularly used to forget in your office, keep one step in your car, keep one step in your home. So wherever you go, and immediately you are able to take the medicine. So this is a small example. Okay. So you should assist the patient in developing a plan. How the patient has to take the medicine if he is working. So for example, one patient came to us. Okay. So the patient's problem was he is a daily wage worker. Daily wage worker, and he has to take one capsule thrice daily. And the storage of the capsule is 2 to 8 degrees Celsius in the fridge. How would you advise to take the medicine? How would you advise to take the medicine if the storage is 2 to 8 degrees Celsius? How can you assist the patient? He has to take 3 times a day. I am asking you, I also didn't know what to tell to the patient. We found a solution, but still. So any answers? Ice pack. So from the pharmacy we get a lot of drugs to the pharmacy. Thermocol boxes, ice packs. It comes to the pharmacy. What is the cost of it? It comes to the pharmacy at almost 0 cost. The revenue from it is, when it is disposed, they will get a scrap amount. That is the revenue we get from the ice pack and thermocol boxes during delivery. So we gave it to the patient. Patient was happy. He took it. 21 days he continued. Whenever he goes back to home, he can keep the ice pack in the fridge. So these are simple solutions. So which helps the patient to continue taking the medicine. If we could not give the solution, patient was not ready to buy the medicine because it will be waste. Okay, such kind of simple tips, okay, hacks can help the patient. Next is how long it will take for the drug to show an effect. This you might have seen. How many of you see pregabalin and all those drugs? Pregabalin, methyl cobalamin, all those drugs you might be taking. How long does it take to act? So doctor will say it is given for some kind of pain, neuropathic pain. So immediately is there any pain relief? What will you say to the patient? So you should continue taking this for the prescribed period. It will have only effect after certain number of days. It will not show any immediate effect. So similarly in case of asthma, some drugs shows effect only after certain dosages. Or else, any drug, can you say any other drug? For example, Montelukast acid. It will show its effect on the first dose itself. But the maximum effect is shown after a week's dosing. So similarly, you have to make the patient aware how long you have to take the medicine. It's very important. If I take antibiotic, if I take for 5 days, 15 days, 20 days, 3 days, the patient may not know. There are numerous instances when the patient comes to the pharmacy. I want this drug. Last time I had cough, it has not reduced. I have been taking for 10 days. I want for 10 more days. This is a very common insight in the pharmacy, which you will see, which I am seeing, which you might be going, okay, to get the drugs. So, taking drugs beyond the prescribed limits, so it can have severe side effects. This has to be conveyed to the patient and make them understand. And for example, if high risk drugs, warfarin and all, then there are cases where patients come with bleeding because patients continued the drug. They will go to some local pharmacy, very small shops in the village side to get business also, or someone who gives the medicine to the patient for 1 month, 2 months, 3 months. The prescription will be for 1 week. The patient will take this, have severe internal bleeding and gets admitted to ICU. The patient health is gone, economic condition is gone. So once it is admitted with severe internal bleeding and admitted to an ICU, it will cost in lakhs. So all these things has to be taken care. Then explain the precise dose, what to do if the patient misses a dose. What should we do? What should we do if we miss a dose? This is for you. You should tell. Huh? Even. The most common we give is advice is take it as soon as possible. Whenever you remember, take it as soon as possible. Or if it is near to the next dose, skip the dose and do not take double dose. So this is the, if you go to any patient council websites, you will see the same point, except for certain medications. Okay, so there are medications taken once in a day, which has to be taken at the same time. Very narrow therapeutic index drugs. In such cases, you will have to maybe increase the dose a bit or all. So that is according to the drug, you have to change your statement. Okay. Emphasize the benefits of completing the medication as prescribed. How many of you have stopped antibiotics in between? Doctor has written for 5 days, you not have taken for 5 days or 3 days. Whenever you feel better, you forget about the medicine. Either you forget willingly or you don't, you forget just like that. Many of us are, I have done that, I have forgotten, okay. I had 10 days of antibiotics. I have taken for I think 7 days. 7th day morning I took and I had to go home to my native place. I went to native place, forgot. Did not complete the course. So what happens next? Especially with antibiotics, what happens? What is the threat? Resistance. Maybe after 1 week I am getting the same disease, same antibiotic is not effective. Maybe effective, may not be effective. There is a high chance there is a evolution and resistance. Then explores with the patient potential problems in taking medication as prescribed. See, I told. Similarly, the temperature issue, cost of the medicine, access. So many of the new drugs cost in lakhs. For example, an antibiotic patient had severe sepsis, some bacteria, okay, carbapenem resistant, we have to give Savisofta plus Astrionum combination. How much does it cost? Any idea? Any intention? Intention? From the intention people. You have studied pharmacoeconomics, right? 5th year. So any idea how much does a Savisofta injection cost? So it costs around 4,500. So 3 days, 3 doses a day, 13,000. If the patient has to be continued for 10 days, antibiotics around will be costing 1 lakh plus. So what is the way forward? How do you give such medicine to the patient? If patient does not, it will always be accompanied with a bill, certified bill. Otherwise, we don't give it in hospital if you are buying from outside. Okay. Then any other access? If it's a rural area, if medicine is not available, so we have to provide. We now provide courier services. If the patient wants the medicine, If it is our own patient, we have the details with us, patient, we will know how much medicine the patient has purchased, what the doctor has advised. So patient did not have money last time when he came, he bought for 1 month. Doctor has written for 3 months. We have the prescription. We send them as courier. We don't charge any courier fees. We just send the medicines required by the patient and collect amount online. So such kind of helps, such kind of problem solving level should be there. Next is helps patient generate solutions to potential problems. You have to ask patient, what is your solution for your problem? Okay, so your patient should be able to give solutions for their problems too. Sometimes patients come up with different ideas. I am saying here, my work is here, my work schedule is like this, I will adjust like this. So we have to see whether it is effective. Then next is discuss significant adverse effects. I told you in the beginning, adverse effect can, one single dose may cause a small adverse effect. First dose might cause little nausea, little gastric upset. Patient will stop the medicine. It might be written for 1 year, 1 month, 3 months. Patient will stop the medicine at the first dose. Especially if he is having some gastric troubles. Okay. A lot of people have come to pharmacy, come to me and said, this tablet is giving me gastric trouble, I don't want this tablet. We cannot give any other tablets, we don't have any replacements also. In such cases we have to give remedies. There will be drug-drug interaction, drug-food interaction, maybe acidity is due to, I told earlier, due to coffee. Excessive coffee intake, food habits of the patient, all this thing can interact with patient's knowledge. Okay, I am taking it without any knowledge. Doctor told me to take it, that's why I am taking it. Nothing, I am looking nothing, anything, and I have these problems. So this is your responsibility to educate the patient. Drug-drug interactions, drug-food interactions, drug-disease interactions. So it is also your responsibility how to prevent and manage those. For example, if I have hypoglycemia, I am taking sugar tablet. I am taking tablets for sugar. I am taking insulin. First, so if you are taking any sedatives, you should not drive. You should not use heavy equipments. You should not do strenuous activities. All these things has to be advised to the patient. Next is provide accurate information. You should be able to know. You should know what is the drug, why is the patient taking. You cannot give any vague replies to the patient. This might be for that. The doctor might have written for this indication. He might be thinking like this, so that's why he might have written. This might happen. This might give sports, but all those things should be avoided. It is for this. You should have a definitive answer. Next thing, discuss storage recommendations, ancillary instructions, all those things. The storage, where to store. You might have seen store at a cool temperature, cold temperature, fridge. These are different temperatures. It will be room temperature below 30 degrees Celsius, below 25 degrees Celsius. This has to be educated to the patient. Ask the patient not to keep your medicines near the window side where direct sunlight, direct heat will fall. This will cause deterioration of the medicine. Next, shake well usage instructions, how to use, how to dilute the medicine. For example, if you are giving a pediatric patient, you will be giving antibiotic, amoxicillin suspension. It comes as one powder and one bottle of water. Or sometimes it does not come with water. You should tell them how to mix it. Next thing is conclusion. You have to ask questions to the patient, verify patient's understanding via feedback, then summarizes by acknowledging and emphasizing key points. You have to ask, you should confirm that the patient has understood. Whatever you have taught them, he is able to reply to your questions. Provides a final concerns and questions. You should, before the patient leaves your counter, I'm audible. Last. You can hear. Follow. So one thing is about therapies. It is never like you take for 5 days, it is over. It may be for 2-3 months, but the doctor might have only written for 1 month. After 1 month, the patient has to come see, evaluate their condition. Then you have to continue. So if you don't facilitate this follow-up, in our hospital, what we do is such patients we take a note of such patients who are on chronic medication, we call them and tell that this, you have to do these and these tests if you are continuing the medicine. So you do not continue the same doses prescribed without consulting. All this information is passed on to the patient so that he comes again and reassesses and then so help the patient to follow up basically. So next you have to ensure the patient comes again to you after for reassessment and for next dosing schedules. So next is communication. This I am not explaining, everybody might be knowing. It is the basics. So one is uses language that patient is likely to understand. Language, common language, if it's English, Malayalam, Hindi, whichever, you have to use the language of the patient. Next is uses appropriate counseling aids to support counseling. You can use digital media, YouTube videos, leaflets, or podcasts, voice podcasters, and any media, digital media. Nowadays it's generative AI. You can use those to educate the patient. Then responsive understanding and empathic response when a patient is expressing his concern, his or her concerns, you should empathize with it and respond accordingly. Not, oh, it is like that. It's not a good response. Next thing, present facts and concepts in a logical order. Order is very important because you have to say important thing first, and or you have to go in ascending order or you go in a descending order. So the patient is able to grasp the situation. Why he's being treated like that. Maintains control and direction of counseling session. You should be in control of your session. So you should never let the patient overtake you. Patient asks unwanted questions, drag you to different areas, different medicines, unrelated questions. All this will come because the patient wants to know more. Patient might get curious. Patient will drag you to different areas. So you should be focused and you should control the counseling session. Probes for additional information, uses open-ended questions. So if you have to ask the patient whether he has any further doubts, and also you have to ask open-ended questions. Do not ask yes or no questions. Patient will not respond. And when he will finish the session, he will say just yes or no. Okay. Next is displays effective non-verbal behaviors. Eye contact, audible voice and a good speed. Next is body language. These I think third years are well aware. Third year, fourth year. Same from the textbook. Whatever you refer to. Okay, voice is audible, tone and pace are good. Body language, posture, gesture, support the spoken message. Distance between the healthcare professional and the patient is appropriate. You might have learned what is a private conversation, counseling, different distance between the patient, interpersonal. All this, it is the right thing. Parthasarathi textbook you use. This is in the textbook. Then this is for community. What did I say? So these are the main things when you counsel. Okay. First, understand patients, medicines, users, patient counseling needs. What are their needs? Why they have come to you? If somebody has come to you voluntarily, you should know why they have come to you. Then integration of patient counseling with routine dispensing. So whenever you dispense medicines in the pharmacy, after the patient receives the medicine, in his hand, there should be immediate setup to counsel the patient at least for a few minutes so that he can get some information about the drugs. So like our sir told, India has a very huge population. It is very difficult to control the patient rush in the pharmacies, big pharmacies. Maybe we have 300, 400 patients in the morning session. So it is very difficult. So make sure the patient have at least some time after dispensing to discuss his concerns. The next is assuring the patient counseling competency of the person and creation of new innovations meeting needs for the patient. So the patient should feel whoever is giving the information to the patient is an authentic person. He is giving some authentic information. You cannot ask somebody to sit at the corner of the hospital and advise the patient. So you should have that authority or authenticity. Next is communication skills. This is not my point, but it is, I think our college has to take some initiative. Teach everyone some soft skill, not just communication, other soft skill as well. Okay. So communicating skill, presentation skills, how to use different medias, all this thing has to be learned. You also yourself, if you want to speak publicly, if you want to do something, communication skill is very important. Learn to put yourself in the shoes of a patient. So I asked you to write some questions, right? So try asking that questions who is sitting next to you. You have written some drug of your choice, so you try to ask those questions who are sitting next to you. So you will get more knowledge. So you will be able to communicate more effectively if you practice it daily. If you practice it as a regular session. Next is improvise and feel more confident in different situations. So this is confidence comes from knowledge. If you don't know about the medicine, you will never be confident. So first thing, whenever you study your pathophysiology, microbiology, pharmacology, pharmacotherapy, kinetics, you should be paying attention. I did not, then later I understood. When some patient comes and asks you, this drug is given, why is it given, how long it will be in the body, what are the side effects, all these questions will come to you. At that time, you should be able to say one thing. If you can't say, there should be something with you to answer. Okay, some apps you may be seeing up to date, something not validated apps, not something vague. Understand communication skills in your own performance. You should assess yourself and continue. Then can experiment with different communication techniques. Learn to develop a new communication style with the patient. Then learn applied pharmacotherapy. Learn applied pharmacotherapy to determine critical issues to be discussed with the patient. This is very important. The core subjects: pharmacotherapy, therapeutics, pathophysiology. If the patient says some symptoms, and if you have to relate them into the medicine, you have to know pathophysiology and pharmacology. So it is very important to learn those. Again, modify the message by using different techniques. Listening skills, it is very important. You have to listen to the patient, their queries, concerns, questions. You have to listen carefully and answer. Then train to present the information according to the needs of the customer. Understand principles of two-way communication. I told you, always patient counseling is a two-way communication, not a one-way communication. Next thing, become aware of your own attitude to the patient. Learn to understand myths and beliefs behind your own performance. Gain feedback and self-assessment skills. Self-explanatory. So, your attitude to the patient matters. Myths and beliefs, I told you, patient comes with different myths and beliefs. Even you might have some myths and beliefs. This drug is called, I have read somewhere, you have read somewhere, right? Okay, then gain feedback. Get the feedback from the patient. Or if you are role playing, ask your, say, who is sitting next to you, ask them, how was my performance? If it was bad, give genuine replies, it was bad. And what was bad, you have to explain. If you say it was bad, you have to explain why it was bad, what was bad. This is same thing, assessment, you have to assess the scenario, like background information, all those things. Then you have to have a care plan, what all drugs are being given to the patient or what all care is given. This majorly for patients who are admitted. Then you have to follow the patient up. whether the patient is continuously taking, whether he is keeping up the scheduled visits, he is taking medication adherence, all those things have to be taken care of. Healthcare professionals can help, pharmacists, perception knowledge and experience can help, communication skill is very important. Then we have the healthcare professional, patient perceptions, knowledge and experience, all these things are important when it comes to patient counseling. Then technology. I already told you can use different medias. There is YouTube. If you want to tell a patient how to use insulin syringe or insulin pen, readily available. You can send a link or you can do a video of yourself how to use insulin pen, inhalers, rotahalers, etc. You can upload to YouTube whenever a patient asks. If the patient don't have time, you can send it to the patient. Or else, newest trend is Gen AI. What is Gen AI? Generative AI. We can feed what are the instructions to be given to the patients, and then whenever the patient buys something from the pharmacy, automated message goes to the patient. These are the instructions for your medications. Our AI software recognizes instructions are given, but there should be human to verify that. So those things can be incorporated into patient counseling for a large model. So next thing is your online blogs, everything has to be clean. Then this is the final thing. Okay. Pharmacotherapy, communication skills, and lifelong learning and developing professional competence. Told you. At whatever stage, pharmacotherapy, communication skills, and lifelong learning. These are constant with wherever you go, whatever profession you are in, you have to do this. Next is self-assessment and feedback. So you have to assess yourself. You have to assess if you have to help your friends assessing these things, and you have to improve yourself. You have to help your friends improve. You have to practice continuously. Then only these things will come to you when you go to a patient setup, when you go to a hospital setup, when you go to a community pharmacy setup where you have to advise or counsel a patient. So any questions? Any questions? Any questions?
Thank you, sir, for sharing your deep and insightful knowledge with us. Your session was full of valuable information. For the next session, I would like to invite Dr. Salman Faris A, Senior Clinical Pharmacist and Assistant Professor, Department of Pharmacology, ICRA International Hospital and Research Center, Calicut, to take seat on the stage.
request Hasna Fatima KP of 6th Form B to introduce our speaker, Dr. Sarmanal Faris A.
A very pleasant morning to one and all in present here. I'm Hasna of 6th Family. I'm pleased to introduce today's speaker, Dr. Salman Faris A, senior clinical pharmacist and assistant professor, Department of Pharmacology, ICRA International Hospital and Research Center, Calicut. Sir is a senior pharmacist and academician. He is an alumnus of Srinivas College of Pharmacy, Mangalore. Sir has organized various workshops, seminars and awareness programs on patient safety and pharmacovigilance. Sir currently serves as a senior clinical pharmacist and assistant professor at ICRA International Hospital and Research Center, Calicut. Sir oversees Area Monitoring Center and Drug Information Center. Today, Sir will be speaking about advanced level workshop on adverse drug reaction monitoring center. To maximize the benefits of the session, I recommend actively engaging and participating. Share your thoughts, ask questions, and contribute to the discussion. I kindly request you to proceed with the session, sir.
Good morning all. First of all, I thank Srinivas Pharmacy College Management, our principal, Dr. Shankar sir, HOD, Dr. Shankar sir, and all other colleagues, assistant officers, for giving me this an opportunity to talk here. As our previous speaker, Dr. Endo, and our guest, Drug Inspector, all were talking about ADR and its importance. The lack of resistance in the ADR reporting. So this topic is very important in case we are working in medical field. Okay. So you all will be knowing the definition of ADR already defined by the WHO. It's an unintended or nauseous reaction caused by a drug which is used in the normal dose, okay, for the treatment of a disease or for modification of the physiological function. Whereas we all will be confused about adverse drug reaction and adverse drug event. We will be facing this while working in the practical side. Because we all are drug experts. So we see every reaction from the side of drug only. We won't be assessing whether the reaction happened due to disease. For that, we need to take the patient history correctly. First main duty of a clinical pharmacist is to take the history of the patient. That includes reconciliation, proper drug history, and other comorbidities of the patient that we need to correct initially. Then only we can assess whether the reaction is caused by the drug or by the disease. So adverse events are any unwanted medical occurrence that are not directly linked to the drug. May also caused by the medical condition of the patient. Whereas side effects are mild and temporary, and it is already feel-able. We will be knowing after taking this medicine, this reaction will be occurring. That is called as side effect. Whereas adverse drug reaction is unpredictable. It can cause at any cost, and it may be severe. It may be mild, it may be mild to severe. On that basis, the WHO has classified mild to lethal cases. Okay. In mild cases, there is no need of any withdrawal of the medicine or dosage correction. For example, we will be knowing opioid causing constipation. That is mild only. Okay. In these cases, we will be taking this benefit ratio. Here, we need to process treatment. Like opioid treatment, we need to continue. Whereas in moderate cases, discontinuing of the drug, it is not necessary, but we can add another regimen. For example, we are taking NSAID cause edema and hypertension. There is no need of withdrawing the medicine. We can add another medicine for the hypertension In that condition, we need to withdraw the medicine. In lethal cases, the patient may cause death. Okay. For example, we are taking atracurium. It's an what is atracurium? Anyone know about atracurium medication? Anesthetic medicine. It may cause death. Based on the Whelan-Brown classification, first one, augmented reaction. It is directly linked to the medicine and it is predictable also. We all know sulfonylureas. It's an anti-hyperglycemic drug. After taking this, we will be coming to know the patient may cause hypoglycemia. That is classified as type A. Whereas in desired reaction, the pharmacology involved the medicine is withdrawn. For example, in broad spectrum antibiotic, it may cause interaction with the microorganism and cause oral infection. Whereas in chronic or chemical reaction, phlebitis can cause. And in delayed type reaction, if you are taking an example, if a patient met with a road accident and he need any ACL or total knee replacement and implant to be placed. After placing the implant, the infection or inflammation may cause. It won't be, the reaction we won't be knowing immediately. After 2 to 3 years only the reaction will be starting. That is called the delayed reaction. Okay. Then end of the treatment. That means withdrawal of the any drugs like opioid. If you are withdrawing, the reaction may come like withdrawal reaction. In familial reaction, that is genetically predisposed. In, for example, sickle cell anemia, we will be taking the patient having sickle cell anemia, and if they are taking any vasoconstrictors, then there will be worsening of the condition. Then genotoxicity is a irreversible genetic damage may occur. Then hypersensitivity. It is a major and common area seen. And for example, Stevens-Jones syndrome, SJS. The severe form is 10, means TEN. It is caused by vancomycin, some other antibiotics, broad spectrum antibiotics and all. Then unclassified. Their mechanism we won't be knowing how this area is happening. For example, muscular reactions of simvastatin, lipid-lowering agents. Then who can report the ADR? ADR can be reported by anyone. As our drug controller told, we are not knowing where we are reporting on. No one was answering where to report, how to report and all. Okay. We are healthcare professionals, most of them were sitting here with farmers and farm students. No one answered that question. So, healthcare professionals, non-healthcare professionals, consumers, patients, everyone can report. Okay. Then when to report? The report should be, the area should be reported immediately, because if you are delaying the report, that can cause loss of some data. That may affect the quality of the area. The area which will be reported now, that will be assessed by the central government, IPC. They will be checking whether is there any complete data, like lab data, patient history. If there is something missing, the quality of the area will be low. Based on the causality assessment, we are assessing the quality of the reaction. So what to report? Every prescription or every area caused by the prescription of non-prescription medicine. For example, if you are taking OTC medicine, we will be taking OTC medicine. If there is any reaction, we can directly report to the nearest AMC center, irrespective of the product information delivered by the company. In the medicinal package, it will be already mentioned what is the side effect of the medicine. In the patient information leaflet, it will be already mentioned. Other than that, there will be some reaction, any unintended reaction for that. That we need to report. Then unpredicted reaction of the ADR along with the product irrespective of their nature and severity. Then serious reactions we need to report. All suspected ADR related to drug food and drug disease interaction we need to report. Overdose or medication error leading to ADR. Medication error can lead to ADR. Do you know vancomycin flushing syndrome, Rutman syndrome? That we can discuss. Uncommon lack of efficacy or detection of suspected pharmaceutical form. If any drug is introduced in the market, by reporting the ADR, we can assess the quality of the medicine, whether they are having any efficacy problem. Then the question arises, how to report. The government has already introduced a form. Within 3 years, they will be renovating the form. Now the version number 1.4 is used by us. It's for healthcare professionals In this many tabs are there. I think it's not clear. Right. First will be patient information, then the suspected reaction is the suspected medicine, lab data, past medical history, every details we need to complete in this. In detail we will be discussing later. Then for consumers, for patients they can report directly to central government. 9 languages, in 9 languages IPC has introduced this form. In Hindi, Malayalam, every language this form is available so that patients can directly report this form. Okay. Then components of the ADR reporting form. First one, patient information. Without patient information, our ADR won't be accepted by the central government. The age and gender, these two things are very much important while reporting ADR. Then only they can assess the medicine, which class of patient the ADR is causing. Then suspected adverse reaction, that is the main thing, ADR. Then lab data, that we will coming to know here. Levels of lab data in ADR reporting. Without lab data, how we can assess whether the reaction is caused by the reaction, the drug or not. Alright. For example, we are taking heat. Do you know about heparin induced thrombocytopenia? Do you know? First of all, we need to assess that 40 criteria has been met. In 40 criteria, thrombocytopenia, timing of the platelet count, thrombosis of other sequelae, then thrombocytopenia or other causes. These criteria should be met by this condition. Then only it can be classified as heparin thrombocytopenia. If they are not meeting this criteria, then it can be caused by other drug or any other disease condition. Okay, so lab data is important in every ADR cases. Do I need to explain about Fortiscore? Do you know about Fortiscore at all? Can anyone answer Fortiscore? As we know, thrombocytopenia normal range from 1.5 to 4.5. In first criteria, thrombocytopenia, this is a scoring system. Okay. In this first criteria, thrombocytopenia, if the patient have less than 1.5, then it can be classified as thrombocytopenia. Then timing of the platelet count. Then after starting of the heparin, when the thrombocytopenia has been started, minimum 5 to 10 minutes it should take for meeting the criteria. Then thrombosis or other sequelae. Is there any reaction has started? Is there any thrombus formation? Then based on that scoring is there. Then thrombocytopenia, other causes. Whether this reaction is caused by drug or any other disease condition. Based on this, it is diagnosed. Then cotrimazole induced hyperkalemia. As we know, Cotri is a broad-spectrum antibiotic. It's given for mild to moderate severe conditions, infections. It's like PCP. As we start the Cotri treatment now, cotrimazole treatment, the hyperkalemia will be getting by step-by-step process. Directly, our potassium level won't be getting increased. By step-by-step only, the hyperkalemia will be increasing. So, while reporting ADR, if a reaction starts on 5th of this month, then we should not mention the potassium level of on the 5th only. We need to report 4th, 3rd potassium level also. Then only we can assess when the hyperkalemia started, whether the hyperkalemia is caused by the cotrimazole. And one thing we need to note also, management of this area. Like cotrimazole is given for severe infection, so we cannot decrease the dose because it is given for severe infection now. That won't be affecting the microorganism. So we withhold the medicine and start to another medicine. For example, in PCP cases, there is only one option other than cotrimazole is primactin. Then importance of medical or medication history. While preparing this slide, I shown this slide to physician in post-surgery assessment team. Then he told like, take half an hour and discuss about this slide only. Because they are facing mainly about this disease. In our hospital there are more than 60 clinical pharmacists are working. So every CPS will be reporting ADR, daily we will be having meeting on the ADR. So the physicians are facing problem like the reaction may be caused by the disease. We will be thinking from drug side only. We won't be thinking from disease side. So they are facing, there will be every day they will tell like, hey, this is caused by this, can't be any idea. So we need to correct the patient history. Medical and medication history, both should be correct. For example, in a CKD patient, there will be having low glomerular filtration rate. So there will be edema condition for the CKD patient. For example, hyperkalemia and hypernatremia. It's caused by the disease. Whereas for this condition, edema condition will be giving furosemide. If you are giving furosemide, there will be increased urine output. Then there will be hyponatremia and hypokalemia. That is caused by the furosemide. That is the difference between medical and medication history condition. Okay, so we need to correct the history properly. Then seriousness of the reaction. First one, hospitalization prolongation. If you are taking any steroids now, then you will be getting the chances of hypokalemia because there will be increased urine outflow. If you are getting hypokalemia, then the patient condition may get bad. Then the hospital prolongation need to be increased. Then life-threatening condition. As I told, vancomycin flushing syndrome. As it is also called as Redman syndrome. The vancomycin should be administered within 1.5 hours, minimum 1 hour you should take. In some conditions, system or what nurses what they do, in 50 minutes they will inject the medicine. It can cause severe reaction like Redman syndrome. That is life-threatening condition. Okay. Then disability. The aminoglycoside like amikacin can cause autotoxicity, neurotoxicity and nephrotoxicity. Then congenital anomaly, thalidomide tragedy. Without telling thalidomide, ER presentation won't be complete. From thalidomide only, every pharmacovigilance process has started. In 1950s, thalidomide tragedy has occurred. First of all, that thalidomide was introduced for healthcare options to induce sleep. Then later it is used by pregnancy women in 1960s only for morning sickness to reduce the nausea vomiting symptoms. And in 1961, the reaction had occurred in the neonates. Some phacomelia-like reaction, abnormalities in reaction, there will be disabilities will be shown. Okay. From there only, pharmacovigilance gets stronger. Then death, atrogenium induced death. As I already discussed, atrogenium is an anesthetic medicine. In Kerala, 2 reports were there. From our hospital, Ikra hospital, 1 report was there. From Perindalmanna, Al-Shifa hospital, 1 report was there. From both cases, the patient was from, it was my age only, 25 to 30 years only. They both met with an accident and came for ACL. Both cases were similar only. They came for an ACL surgery. Then during anesthesia, atrogenium was given. Patient went to malignant hyperthermia. Malignant hyperthermia means serious fever spike will be there. Then they are shown symptoms of the shock. BP was low. Like shock symptoms were shown and the patient went to death. And one controversy was also there, the patient was using MDMA. In MDMA cases, pupil dilation will be there, BP will be low. So after using atrogenium, it can worsen the condition. Then suspected medicine. In suspected medication, brand name and generic, both are important. Why brand name is important now? If you are reporting the brand name, some of the brand will be having low quality, so they can cause ADR. So if you are reporting the brand name, the IBC can recall that medicine only, other than recalling the entire generic of the medicine. Then manufacturer. If you are reporting the manufacturer, it will be more helpful for IBC to contact that. Then batch number. If you are recalling any medicine, that batch only, that will, first of all, they will be recalling that batch only. Then still reaction occur, then they will recall entire medicine. Then dose road frequency. As I already told, vancomycin and example. It's very important, like at what dose, in which route, at what frequency the medicine is given. Then therapy start and stop time. Using this therapy start and stop date only, we can assess whether the drug is caused by, the reaction is caused by disease or pain. Then re-challenge and de-challenge. In de-challenge, if a reaction is occurred, then we will be discontinuing the medicine. After the discontinuing can be either after completing the entire treatment or by suddenly we will be discontinuing the medicine. Whereas in re-challenge, if a reaction occurs, we will be discontinuing the medicine. After that, we will be reintroducing the medicine. For example, ATT-induced hepatitis. It's a common area. After taking ATT medicine, giving medicine, we will be coming to know about hepatitis, ATT-induced hepatitis. In that condition, re-challenging is like two methods are there. In first method, we will be giving low doses of every drug. Paracetamol, isoniazid, ethambutol, and FARMACY. Then the second method is like introduce first medicine first. For example, first of all introduce isoniazid, then check whether the reaction is happening. If the reaction is happening, withdraw that medicine, start the other medicine. Okay, like that. Two methods are there for hepatitis induced. Then causality assessment scale. There are two commonly scale used in India. Under IPC, we are using WHO causality assessment scale. Other than this, narrow scale is there. In narrow causality assessment scale, there are it's like scoring system. There will be something 8 to 9 questions are there. Based on those questions, a scoring will be given. Whereas in WHO causality assessment scale, based on this certain probable, possible, unlikely, and condition, area will be classified. In this certain condition, there will be every information about the area. Like lab data will be there, present history, medication history, everything will be there. Whereas in probable, some data will be missing. Based on this, we will be classifying causality. Then resistance to reporting. As I already told, lack of sufficient data. If there is no sufficient data, how can we report area? Then lack of knowledge and awareness to reporting, lack of time, lack of information about area monitoring center in other healthcare professionals. This is the main thing we are facing in our hospital because so many physicians and nurses they are not knowing about the AMC. So we are giving awareness about AMC in hospital and in public hospitals. Then uncertainty of the area diagnosis and potential conflict derived from the area reporting. It is nothing but we will be reporting an area, as I already told. The physician will be telling this area is not caused by the drug, it is caused by the medical condition of the patient. Okay. So in area formally it is telling like suspected area reporting. We are suspecting that it can be caused by either medical condition also. If you are suspecting, reporting. The other things will be looked at by this. Lack of regular laboratory investigation. For example, if a patient is taking quetiapine, it can cause QT prolongation. If the QT is not monitored, then how we can report the area or how we can diagnose the condition of the patient. So, lab report is important in case of area reporting. Then the role of clinical pharmacist in area reporting and its management. First of all, we should assess the area what we got. Then review the suspected medication based on the dosage form, route of administration, whether it is caused by the drug. Then based on the physician, we can assess whether it is adverse drug reaction or it is adverse event. Then clinical pharmacist intervention in the management of the event. Then report area to the nearest AMC by assessing the causality. Then hypersensitive reaction. It is a common area seen and its treatment is like injection hydrocortisone 100 mg stat, phenyramine 22.75 mg and pantoprazole 40 mg and ondansetron 40 mg. Everything will be given stat. If the patient is not okay and if it is getting severe, we can give Vilastin 20 mg. And for anaphylactic shock like condition, the patient can be shifted to ICU for inotropic support. Then what is superinfection? You don't know about superinfection? The infection secondary to any antibiotic exposure. For example, Clostridium difficile. Clostridium difficile, this organism is already present in our gut. antibiotics and all. This CD can get severe. That's called as CD, Clostridium difficile infection. It can be diagnosed by GDH and endotoxin and if they are positive, we can go for treatment. Treatment it will be vancomycin, capsule of the vancomycin it will be given 125 mg, use systemically for 10 days. But in India, 125 mg is not available, so we will be giving 250 mg tablet. Capsule we will be giving. If the condition is more severe, we will be adding metronidazole 500 mg TID. And if you are referring any articles or any book, we will be seeing fidaxomicin 200 mg BD. But fidaxomicin is not available in India, so we will be going for vancomycin and metronidazole only. Then if endotoxin A and B is only positive condition, we will be giving basilatuzumab. And vancomycin retention enema is only given in this condition only, CDA condition. Retention enema is 500 mg in 100 ml we will give. Then how to implement ADR monitoring in an healthcare setting. IPC has already introduced a form like letter of intent. I will show you. In letter of intent, we need to fill the complete details what they are asked, like how many bedded hospital, how many staff are there, like there many questions are there. Then within last 1 year, how many ADR we have reported. That complete details we need to send to IPC Ghaziabad. Then they will be giving approval for the AMC center. Then AMC coordinator and deputy AMC coordinator will be assigned from our institution only by IPC. Then pharmacovigilance associate will be assigned by IPC. That staff will be implemented by IPC. Then Vigiflow assessment will be. Vigiflow I will tell you how it is working. Last I will show you how the Vigiflow is working. Then in our hospital, AMC is working like there are total 536 AMCs in India, and ICRA is ranked in the top 10 AMCs because we are reporting as many areas we can. There are resources we have, enough CPs we have, doctors, physicians, then nurses, everyone is helping in reporting area. They are not lacking of report. There is no lacking of report. Everyone will be reporting. Based on the causality, physician will be assessing whether it is ADR or not. Then will be the pharmacovigilance associate will directly enter the GPO. More than this reporting ADR, we are doing many things like conducting awareness program among public. And the scope of the area. First in research. In ICRA, there are many researchers going. It's a transplant and procedure. So, in transplant patients, many immunosuppressants will be taken. So, we are having many researchers based on this, like tacrolimus and all many drugs are under research only. And publications. Even I have many publications based on this area. Like ondansetron-induced Ogilvy syndrome, atraquidine-induced many publications. There's a scope is there. Then pharmacovigilance. If you are having any experience in ADR monitoring center, it will be more helpful to get into pharmacovigilance. Detailed pharmacovigilance will be taken by tomorrow already. Ajay will be taken. Then AIMS. One more thing, I will show you how the GPO is working. Okay. This is the first interface shown in VGFlow. In this report list now, if you are taking, we can see how much area reported by ICRA. Then here it is new ICSR is there. If you are clicking this, we can see many tabs here. Reported information, patient case narrative, many tabs here. These all information are available in our area reporting form only. In reporter information, we can write all the details of the reporter. Who is reporting the area and who is entering in VGFlow, then we can write here, sender information. Then in patient information, here it is sex, age, and initial of the patient. These three criteria are important for reporting area. Without this, we can our area won't be accepted by the IPC. Then case narrative. In case narrative, we will be writing a brief note about how this area is occurring. Then medical history. It will be medical or medication history that we need to fill here. And in which flow metracoding is using. I think in 5th year we are studying about metracoding, right? It's an universal coding system. For every disease and drug, there will be a coding for. And in reaction, what's the reaction we are suspecting? That we need to code here. And in drug, what suspected drug? And in below, you can see one more tab for concomitant medication. Concomitant medication means the suspected drug will be here. Other than that, the patient will be taking other drugs that we can code as concomitant medication. Then test and procedure, the lab data, and in assessment, we can, based on the causality assessment scale, we can assess the causality of the reaction. That's all about Ujjit. Thank you. Is there anyone having any doubt related to MC or our idea? Thank you.
I request our principal, Dr. Srinivas, to present a memento and certificate to Salman Farsi. Thank you, sir.
I again request our principal, Dr. Shagaraya, to present a memento and certificate to Dr. Aldous Betty.
individual that will be given soon.
Online session.
We will start now. Are you ready? Abhinav? Are you online?
Yes, sir. Yes, sir. I am.
Yeah. I will talk. Once it is live, we will talk.
Okay, sir. Okay. I am connecting my laptop.
Hello.
Yes, yes. Yes, brother. Tell me.
I am pleased to introduce our next speaker, Dr. Amit Babaraj, DHA certified clinical pharmacist, Dubai, UAE. Sir is a clinical pharmacist in Dubai Hospital, specializing in critical care, ICU, nephrology and pulmonology department. He is an alumnus of Srinivas College of Pharmacy, Honolulu. Dr. Amit Babaraj is experienced in medication therapy management and drug information dissemination. His contribution in achieving NABH and ISO certification through internal audits and complaints initiates underscore his commitment to quality healthcare. Sir is here to enlighten us on the topic of impact of clinical pharmacists in healthcare management. Over to you, sir.
student Karim approaches the psychiatrist. Hello, Ms. Karim. How can I help you?
Hello doctor, I am a student and I am often feeling depressed and stressed out about studies.
Yeah, feeling depressed and stressed about studies is quite common in students.
Yeah doctor, but I am unable to come out of it.
You can follow these tips to overcome depression, such as create a study plan that allocates time for each subject and topic, pick out completed topics to track your progress and feel a sense of achievement. Physical activity helps to reduce stress and releasing endorphins. A balanced diet and proper sleep contribute to overall well-being. Get socialized, spend time with your family and friends.
Okay doctor, thank you so much for such a healthy tips. I will surely follow them in my day-to-day life.
It's great, Farin, that you approached me. I appreciate that. Mental health is as vital as physical health. Seek help early. Don't suffer silently.
Mental health awareness is a crucial for overall well-being. Here are some important tips. Self-care. Make time for activities that bring you joy and relaxation, whether it's reading, exercising, or spending time with loved ones. Seek support. Do not hesitate to reach out to friends, family, or professionals. If you are struggling, talking about your feelings can help the lighten the burden. Stay active. Regular exercise has been shown to improve mood and reduces symptoms of anxiety and depression. Healthy habits. Maintain a balanced diet, get enough sleep, and avoid excessive alcohol and drug use. Manage stress. Practice stress reduction techniques such as deep breathing, meditation, and yoga to help them manage their risk.
Thank you.
that you are going through a lot of pain, but we are here to help you through all of this. We've given you all the support from our side. Now it's your turn. You must use your willpower to mold yourself.
You could be engaged with family, friends. Do something that makes you happy.
Look, Sharon, suicide or self-harm is not a solution to anything. You need to realize that sparing your life for others is your loss.
You need to learn children. How you work and how you move.
Staying with you, you must be a different person. You must stay energetic. I must see that happiness in your face. We understand what you're doing.
I think I have lumps in my breast. Is it something serious or just my overthinking?
Like have lungs in the breast. Is it breast cancer?
Shut up, don't say anything further. In our Jamana, we had lungs in our breast, but they used to cure themselves. We are creating big scenes out of small things. Don't think too much about that.
Mom, I searched about this online. It can be symptoms of severe disease. I think I should consult a doctor. Don't you need to go to hospital without my permission. The generation people are creating nuisance and this topic ends here. We won't discuss about this anymore.
I need to discuss something with you. It's quite personal. I feel like I have lumps in breast. Should I be concerned about it?
I think you should be concerned about it. Why don't you consult a doctor?
Actually, I discussed it with my mom and she yelled at me and told just ignore it. Don't think too much about that. I don't know what to do next.
Have you lost your mind? You can't ignore such symptoms. It can be something serious. You are an educated person. Let's go to the hospital. So, Vishnu Devi, you are diagnosed with the stage 2 breast cancer.
Mom, you need to tell me something. Actually, I'm diagnosed with stage 2 breast cancer now.
What? Why did you do all this without asking me? What does society think about us? And what about your future? Who will accept you? See, who will get married to you? And see, whatever happened. Don't think about that. And one more, tomorrow boys' family will come to see you. And don't spit a word about that, your breast cancer. Nothing will happen. Go, now get ready.
Don't worry, I'll explain you more. It seems like the cancer has grown beyond its original site to the nearby lymph nodes. But you don't have to worry, it's still an early stage and it can be treated. We have an RCU treatment from surgery to chemotherapy for very specific situations. But apart from medical interventions, I want you to know that your strength and determination also matters. So, let's start the treatment procedures from tomorrow.
even from the freshers itself, there are can you hear me now? When you are coming out of college, with a degree, let's say after session. So I believe all in this session will help you and every aspect, making you wait for your lunch to the college level. So without wasting time, after coming out of the college, I actually was just going to do this extra hours. The topic I was allotted was like the impact of even the power freshers itself. There are things to be known. In this session, I will be talking about the college, who is a clinical pharmacist degree, and what impact does so. I believe this session will help us in every aspect. Is like the next slide, going through the college life, and even after coming out of the college. So let's start. The topic I was allotted was the impact of clinical pharmacists like healthcare management. So in this session, I will be talking more about who is a clinical pharmacist and what impact does he have on a healthcare sector. Please move to the next slide. Okay, so who is a clinical pharmacist? I am sure the freshers will be in more doubt to know what is a clinical pharmacist. And even I am doubtful if the 6 years also will be knowing what a clinical pharmacist will do. So, who is a clinical pharmacist? Next slide, please. So, according to American College of Clinical Pharmacy, so who is a clinical pharmacist? I am sure the freshers, a clinical pharmacist will be someone who might allow you to know what is a physicians and even other doubtful like patients, is also knowing what external formation to the best useful healthcare outcome. So, who is a clinical pharmacist? What does this is imply? So, according to like everybody will be having knowledge of clinical pharmacy. What is the difference between a clinical pharmacist and a normal pharmacist? A clinical pharmacist from the name is someone who has a clinical pharmacy, who is the medication and other related the pharmacy taking more linked to ensure that the medication is prescribed for the patient to the best possible healthcare outcome. Bringing about the best healthcare outcome, the pharmacist has alone do activity. So he needs the inputs from the physicians. Everybody we have preference. Meaning like what is this? Maybe a clinical pharmacist, laboratory technicians and other diagnostic tools. Like this everyone from the name is clinical pharmacist will be more into clinical science, X-rays, these all the pharmacists will be more learning to make a decision right patient. For clinical pharmacists, bringing about the healthcare outcome relation with the pharmacist and other healthcare documents. So he needs to the inputs from the physicians, other healthcare professionals, meaning like next analysis, maybe laboratory technicians and other diagnostic tools like which are CT scans, X-rays. These all culminate to make a decision for a patient. So clinical pharmacists will be directly in relation with the physicians and other healthcare professionals. Please show the next slide. To give the best possible healthcare outcomes. Next slide, please. For that I tell you, I will really recommend you to be in this session because there are many things you should know when you are doing the study process and even after coming out. Let's show the next slide. Because healthcare management. So this is question can be revised we'll be going through some practical examples where we should be learning and practicing from private second answer because we'll be going to hospital before second year only. So what I know we should be looking at what I know we should be more learning everything and studying. So this will help you accept very very well. So what impact do they make on a healthcare management? This question can be rephrased as is safety. Why you are being having this word I get point very clearly in the past because I feel that IIT analysis is being quite recruited only hospital answer just to improve the safety. The only answer like I can tell you is per patient accept. So why I want the name safety because patient safety is very important. This safety, whatever safety is being this word I had point just from here because this I feel of a situation where a patient is getting admitted to a hospital recruiter